The 2022 open enrollment period begins Monday, February 28th and ends Friday, March 11th, 2022. This is the time for you to review your benefit elections and make changes as necessary. Open enrollment is all about giving you easy access to the benefits that help you live better every day. Explore your options for open enrollment, election updates, beneficiaries, and more. In this presentation, I'll go over the open enrollment basics. Congratulations, your monthly contribution rates will not increase this year. You'll continue to pay the same amount for all your benefit plans. There's only one plan design change. Out-of-pocket maximums are increasing to Affordable Care Act limits. As a retiree, you have three options during open enrollment. Option 1, make no changes. All benefit coverages will roll over if you choose to do nothing. Option 2, opt out of coverage. Complete an enrollment form and elect the opt-out on benefits of your choice, medical, dental, or vision. Option 3, enroll, opt-in, or make changes. Complete the enrollment form. Your eligible dependents include a legal spouse, natural, adopted, or stepchildren up to age 26, children up to age 26 over whom you have legal guardianship or legal foster care, grandchildren up to age 26 if they qualify as your dependents for federal income tax purposes and live with you. Ex-spouses are not considered eligible dependents unless a court order has been issued that states they need to be covered on your health plans. Contact your benefits office for full details on ex-spouse eligibility. Step-grandchildren are not considered eligible for benefits under any circumstance. Other eligible dependents include disabled dependents over age 26. In order to qualify, the dependent must depend on you for more than 50% of financial support, must be classified as disabled, and covered on a medical plan before reaching age 26, and approved for coverage after age 26. If you have a dependent for whom a court order has been issued requiring you to provide health care coverage, you must provide the Benefits Division the court order within 31 days of the event. In all situations, the plan's eligibility rules and necessary documentation apply. The City of Houston requires that you submit appropriate documents for all eligible dependents to be covered on health plans. The city requires proof of identity such as a Social Security card or individual taxpayer identification number, and proof of eligibility such as a birth certificate, marriage certificate, or legal adoption paperwork. Please be advised that you will also need to provide all dependents' Social Security numbers and dates of birth to enroll. The list of required documents is available on the Benefits Division website. If you are adding a dependent, you must submit your supporting documents by March 9th, 2022, no later than 4:59 p.m. Central Time. You can submit supporting documents through the Secure Document Submission portal at bit.ly/COH benefits form, or you can bring them in person to 611 Walker, 4th floor lobby. If both you and your spouse work for the City of Houston, you may be covered as an employee or as a dependent, but not both. Dependents may be enrolled under only one parent or guardian if both parents work for the city. Outside of open enrollment, the only other time you can make a change is if you experience a qualifying life event. A qualifying life event is a change in your situation that makes you eligible to enroll or change your health benefits. Some of the most common qualifying life events are marriage, birth or adoption of a child, divorce, gain or loss of other coverage, and moving outside the coverage area. You are responsible for notifying the Benefits Division of a qualifying life event within 31 days of occurrence. If you wait until after 31 days, you lose the ability to enroll or make changes until the next open enrollment. Next, we'll go over the medical plans administered by Cigna. The City of Houston offers 3 Cigna medical plans for our non-Medicare eligible retirees: a consumer-driven health plan or CDHP, a limited network plan similar to an HMO, and an open access plan or OAP. Let's talk about how these plans differ. The CDHP offers a low paycheck contribution and includes a health reimbursement account to help you lower the cost for services. The city pays for the first $500 for an individual or $1,000 for family from the HRA, which can be used to offset your deductible or coinsurance cost. Under the CDHP, you have access to all Cigna providers throughout the country without having to seek referrals to see specialists. There are no copays in this plan, meaning that you'll pay 20% in-network and 40% out-of-network for the cost of your doctor's visits, hospital stays, lab work, x-rays, emergency room visits, and outpatient procedures after you reach your annual deductible. The in-network annual deductible on this plan is $1,750 for an individual and $3,500 for a family. The out-of-network annual deductible on this plan is $3,500 for an individual and $7,000 for a family. Remember that these deductibles are offset by the health reimbursement account. This plan also includes a 4-tier prescription drug plan. You'll pay 20% co-insurance for in-network pharmacies or 40% for out-of-network. Please take a moment to review the premium amounts on the screen. These are the monthly amounts, which include all wellness and non-tobacco user discounts. The limited network plan allows you to choose from 3 provider groups: Kelsey-Seybold, Renaissance, and Village Medical. This means you will need to coordinate your care within these networks. In the limited network plan, you have a lower deductible and pay less for services. The limited plan has a $200 annual medical deductible for individuals and a $600 annual medical deductible for family. Additionally, you will have set copays for primary care visits and specialists. The limited plan has a $150 annual prescription deductible for individuals and a $450 annual prescription deductible for family, except for certain preventive medications which are not subject to deductible. The limited plan does not offer a health reimbursement account, so the city is not contributing towards the cost of services like in the CDHP. If you designate a primary care physician in the Village Medical or Renaissance network, you will need a referral from your PCP in order to see a specialist. If you designate the Kelsey-Seybold network, you do not need to choose a primary care physician. With this group, you can visit any Kelsey-Seybold office in the Houston and surrounding area. You do not need a referral to see a specialist as long as you stay within the Kelsey-Seybold network. At the time of enrollment, a PCP will be assigned to you based on your zip code. As soon as you receive your insurance card in the mail, please contact Cigna directly to update to a provider of your choice. You and your dependents do not need to be enrolled in the same network. For example, you may choose a PCP in Renaissance or Village Medical, while your spouse chooses Kelsey-Seybold. Please take a moment to review the premium amounts on the screen. These are the monthly amounts, which include all wellness and non-tobacco user discounts. The Open Access Plan, or OAP, is the most expensive plan in terms of paycheck amounts. However, it gives you greater flexibility to choose your care than the other 2 plans. The OAP gives you access to Cigna's national network without a need for referrals to see specialists. The OAP has an annual deductible of $850 for an individual and $1,700 for a family. Once you have met this annual deductible, you will pay 30% co-insurance for most services until you reach your maximum out-of-pocket. You will have a set copay of $40 for primary care visits and $65 for a Tier 1 specialist visit or $80 for a non-Tier 1 specialist. The OAP includes a 4-tier prescription plan with no deductible. Please take a moment to review the premium amounts on the screen. These are the monthly amounts, which include all wellness and non-tobacco user discounts. The 3 medical plans have differing copays and co-insurance amounts for prescription coverage. The CDHP has a prescription deductible that is combined with your medical deductible of $1,750 for an individual and $3,500 for a family. This plan also includes a 4-tier prescription drug plan. You'll pay 20% co-insurance for in-network or 40% for out-of-network. The limited plan has a separate deductible from the medical deductible, so this is an additional amount you will need to pay exclusively for prescriptions. The limited plan offers tiered copay amounts for different classifications. The OAP does not have a prescription deductible and offers a tiered copay and co-insurance amount for different drug classifications. Please review the cost for prescription drugs by verifying which tier your prescriptions fall under and carefully consider your options when choosing your medical plan. 90-day prescriptions have a higher copayment and coinsurance than 30-day prescriptions. Specialty drugs in the limited network and open access plans are only available as 30-day prescriptions. You can save money on your 90-day prescriptions by choosing Cigna Express scripts. You'll pay just 2.5 times your retail copay for a 90-day prescription, which can save several $100s a year depending on your usage. There are over 68,000 retail pharmacies in your network, which include local pharmacies, grocery stores, retail chains, wholesale warehouse stores, all the places where you may already shop. 30-day prescriptions can be filled at any retail pharmacy in the plan's network, including CVS, H-E-B, Kelsey-Seybold, Kroger, Walmart, and Walgreens. For 90-day prescriptions, you have the option to use a 90-day retail pharmacy in the plan's network, including CVS, Kroger, Walmart, or you can use Cigna Express scripts. Visit mycigna.com for a complete list of in-network pharmacies. Pharmacies in which you can fill a 90-day prescription will be identified with a 90 symbol. Cigna has partnered with Cigna Express scripts to offer savings on many generic and name brand drugs through mail order. Signing up for Cigna Express scripts is easy and convenient with your prescription shipping to your home for free. Covered medications include generic and brand name asthma medications, generic cardiovascular and high blood pressure medications, generic cholesterol medications, generic diabetic medications, preferred brand diabetic test strips, and brand name insulin. Additionally, if you are a member who's not enrolled in Medicare, you are eligible for a free diabetic blood glucose meter. Call Cigna Express Scripts at 1-800-835-3784 to get started. Next, I'll go over the vision plan administered by Superior Vision. Did you know that eye health is an important component of your overall health? Eye exams can detect many chronic issues, including hypertension, autoimmune disorders, cancer, and thyroid disease. With the Vision Plan, there are no deductibles, just simple copays when you use in-network benefits. You will pay $20 for your annual routine eye exam and $25 for your glasses or contact lenses. The $25 eyewear benefit includes a $150 allowance toward your glasses or contacts, including single vision, bifocal, trifocal, lenticular, progressives, high index, and polycarbonate lenses. Additionally, if you are thinking about laser eye surgery, the Vision Plan offers a one-time $300 credit toward LASIK. Please refer to the City of Houston's HR benefits website for more details. Superior Vision offers many providers to visit for your eye care needs, including iMasters, VisionWorks, Target, Sam's Club, Today's Vision, Walmart, Vision Source, and many others. To see a complete list of providers in the network, visit www.superiorvision.com. Next, I'll go over the dental plans administered by Cigna. The City of Houston is excited to offer 2 dental plans for eligible employees. You have the option to choose between the Cigna Dental Care DHMO plan and the Total Cigna DPPO plan. The Cigna Dental Care DHMO plan is a cost-effective plan that has fixed copays for dental services with no deductible or annual maximum on services. You will need to select a primary care dentist and will need a referral to see specialists. The service area includes all of the United States except for 13. Benefits start on May 1st. There is no waiting period. You will not have to submit claim forms on this plan unless you choose to use services out of the network. There is no charge for preventive services on this plan and fixed copays for basic and major services. If you enroll in this plan, Cigna Dental will automatically assign a primary care dentist based on your zip code. Once you receive your dental ID card, you may contact Cigna Dental to change to an approved provider of your choice. For more information on this plan, refer to cityofhoustonbenefits.org. The Total Cigna DPPO plan gives you the freedom to visit any licensed dentist or specialist. No specialty referrals required. The plan will cover eligible dental expenses after you satisfy any applicable waiting periods and meet any deductibles. The annual deductible is $50 per individual and $150 per family. The annual maximum benefit for Class 1, 2, and 3 expenses is $2,000. The plan is based on coinsurance levels that determine the percentage cost covered by the plan for different types of services. For example, Class 1 expenses are preventive services like cleanings and certain x-rays, and are covered at 100% by the plan. Class 2 expenses are basic services like extractions and root canals and are covered by the plan at 80%. And Class 3 expenses are major services like bridge work and crowns and are covered at 50%. To find out if your dentist is in a Cigna plan, go to www.cigna.com. Choose the Find the Doctor, Dentist, or Facility tab. Under How Are You Covered, select Employer or School. Enter the address, city, or zip code. Then select Doctor by type. Select General Dentist from the drop-down. Under Please select a plan, enter address, city, or zip after I live in and choose to continue. Select either Cigna Dental Care Access or Total Cigna DPPO, depending on which plan you are interested in. Review the list of dentists in the city which you typed in. If you need help choosing a dental plan, contact the pre-enrollment helpline at 800-401-4041. If your dentist is not in the Cigna network, you can submit a dental provider nomination form for contracting outreach. Forms are available at cityofhoustonbenefits.org, or you can request one from the Cigna pre-enrollment line. If you ever need to reach the Benefits Division, we are conveniently located on the 4th floor of 611 Walker. You can also reach us by emailing retireebenefits@houstontx.gov or calling at 832-393-6000. You can also view more benefits information on our website, cityofhoustonbenefits.org.